Hi friends, Dr. Kat here. Wanted to let you know that for our sidewalk sale in June at Amara Day Spa, we'll be running specials on medical all month long. So the specials are $50 off of your own Botox or $100 off for both you and a friend if you bring a friend who's never had Botox at Amara Day Spa. Also, filler deals are $100 off for you or $200 off for both you and a friend if you bring a friend who's never had filler at Amara. So we'd love to see you. That runs all month long, so for all of June. Call soon and get your appointment scheduled because we do fill up for these deals really quickly. Hi, Dr. Kat here. Today we're going to be showing you how we inject lips. We'll be using a product called Juvederm Ultra Plus, and you'll get to see the whole process start to finish. Alright, this is our patient today, Elsa, and we're going to be injecting her lips today. So the first thing I like to do is have my patients look in a mirror. Usually we use the big mirror, but we'll use the small one today, and we just discuss and consult about her current lip shape and then what she's looking for with injections. So with Elsa, we've already talked a little bit that her top lip is about 50-50 proportion with her bottom lip. Sometimes it's even a little bigger because we all swell a little bit in the morning. And so you were telling me that you wanted to have the bottom lip a little bit larger in proportion. Is that correct? Okay. What else are you looking for as far as your lip injections today?
Like I was saying before, I want my lips to look like they do in the morning, so just like a little bit more swollen. And then just you suggested like sharpening up the Cupid's bow because it can kind of get lost.
Yeah, I like to always sharpen up the Cupid's bow. That is the point of light reflection that we have on our lips, and so it makes a really pretty look. The way I do injections on the top lip also helps sharpen the border, which is really nice to keep our lipstick in place. As we age, we often get flat through that border on our upper lip. You don't have that going on yet, but we'll be able to prevent that. We'll also be able to give you a little more of just a hydrated look, so your lips will look just a little bit plumper. You won't have a duck lip or a sausage lip or anything like that. So the next step is that we will get you numbing and we'll get all prepped for the injections. Alright, next what we do is we clean off the lips with a little bit of alcohol here. That part can be just a little bit drying feeling. Yeah, not so great. Then we use a numbing product that is known in the industry as BLT, which is benzocaine, lidocaine, and tetracaine. It's a triple threat of numbing, and we just smear it all over the lips. I'm very generous with the numbing, so rub your lips around like gross chapstick. And we get it all along the outside border. Okay, we'll let her numb for a few minutes, and I will actually add a second coat in about 5 minutes. Okay, this is our product, Juvederm Ultra Plus. And the way I like to prep the product is by putting it in small insulin syringes. That helps keep the product sterile, and it also helps because the insulin syringe needles are a little bit smaller. They're very precise. I'm able to know exactly how much product I put in each quadrant of the lip. So it's a technique that you'll see often. Not everybody does it. It doesn't mean it's bad if they don't. It's just my preference for how I like to do it. So I just fill. I usually start with 4 small syringes. And this is a great way too for people that just want a baby plump, and we only plan on using half a syringe to start because then I'm able to save the rest of the product in the original syringe and just cap it off again so that we can use it for touch-ups if we need to. Okay, so Elsa's been numbing for a few minutes, so we're just going to wipe off the excess here. The front part of your tongue usually goes numb, totally normal. Doesn't taste very good, but that's just kind of how it works. We're going to lay her back a little bit. I can actually take out the pillow, that'll be more comfortable. Put your feet up a little more here. And raise the bed up just a little. comfortable-ish? Alright. Friendly pink gloves. So that while I'm poking your face, you'll remember that I'm nice. I use gauze. I use this little tool called, I call it the Buzzy. The brand name is Vibrata. We get a lot of questions about these. It's a facial massager. It buzzes and it confuses the nerves on the face using something we call gate theory for your nerd info for the day, which means that the nerves are busy feeling vibration so they can't feel the pain associated with the pokes. So I usually do the lips in quadrants, meaning 1 of 4 spots, and so we're going to go ahead and get started. Just relax your mouth open a little bit. Perfect. You doing okay? And I can use the Vibrata to kind of act like my other hand and help hold some tension on her skin so I can have good visualization. Now the way we do this is a little bit different for everybody depending on where we need to place the volume and how much volume we need. I tell everyone to expect some bruising. The lips have lots of vessels in them. I try to keep it as comfortable as possible. And I always keep my needle moving, which is a safety. Because the worst case scenario when you're getting any kind of injections is that we inject filler into a vessel and block that blood flow. While that's reversible, it's something that we try to avoid as best we can. So you can see we've added a little bit of volume over here. And now I'm going to sharpen up the Cupid's bow. This is one of the most tender spots. Good job, Else. Awesome.
I feel like the Buzzy's making my eyes water more than the
Is it?
pokes are.
All injectors kind of have their routine that they like to do. I just like to kind of work around the world in mine and start on one side. Some people like to use different methods. It's totally fine. You can see how that sharpens up her Cupid's bow really nicely. It swells a little bit. She's a little bit of a sweller, so it'll be even sharper once that calms down. Relax, open just a little. Thank you. This product has lidocaine in it, so it will help to numb the lip from the inside. So if we do go back and touch any of these areas up, which I typically do at the end, we make sure everything is even, it'll be a little more comfortable. So for the bottom lip, I usually measure, and we do what we call the 2 pillow technique, which is where, or some people call it lip cleavage, where there's a little bit of a indent in the middle. It's a very natural shape for lips. It helps avoid the dreaded sausage lip. Open a little for me. Perfect. And then this technique kind of flips out the lip a little bit. You can see it as it happens. Doing okay?
Mhm.
So I typically do my shaping at the very end. Sometimes I get a little OCD and shape a little bit as I go, but I do the bulk of it at the end. So we've done that third quadrant. Now we're going to do the fourth quadrant over here. Again, lots of injectors will have lots of different techniques. Relax open for me. The Buzzy is helping to distract her pain nerves. And this is how we customize lips for every single person. It's different for everyone. So now we'll move on to some halfway point shaping. So go ahead and relax open a little bit. This is where I'm doing shaping, so I'm making sure all of the product is down in the lip where I want it and I'm feeling it. Because I use the micro droplets, feeling some little lumps of product is totally normal. They'll integrate with the tissue. She is having some swelling. You can see her upper lip is starting to swell some. Totally normal. This is also when I assess, whether we can do a second pass, if we need to do a second pass. I'll hand her the mirror in a second and we'll take a look together. This is the shaping here of the lower lip. Relax open for me. This is where we create that lip cleavage, is what people are calling it now. Okay, close. That looks really pretty. Okay, we'll grab the mirror here. Go ahead and take a look. So I would like to add a little bit more in the lower lip to make its proportion a little bit bigger than the upper lip. You are having some swelling on the upper lip, so that is distorting it a little bit. But I think that your lower lip could easily handle a little bit more volume.
Okay.
What do you think?
Yeah, I'm okay with a little bit more.
Okay, let's just do a little bit more. Okay, awesome. Relax open for me. So we're just doing a bit of a second pass here, adding a little bit more volume to the lower lip. I always like to check in with the patient and make sure that we're on the same page about what we feel is an appropriate amount of volume. Your lips are going to look and feel huge to you. And then there will be some swelling the rest of today, tonight, and tomorrow morning you're going to say, what did Dr. Cat do to my face? But I promise that they will get better and go down and just heal beautifully. Okay, relax open. Relax open a little bit more. Perfect. Over here where I am now is a really common place for bruising. I just tell everybody kind of expect it. Opaque lipstick is your friend for the first week. Okay, grab that mirror and take a look with me. Middle and the bottom to pop it out. The other thing that we'll do is some philtral columns. So that's these little lines that come down from the nose. Yours aren't super prominent naturally, which is just fine. We'll just sharpen them up a little bit. For a lot of people, it's actually a sign of youth that those are more prominent. When we're younger, they flatten out over time. So we will just pop those a little bit. Okay, so for philtral columns, I'm going to have you hold the buzzy, and you can hold it kind of on your chin. They are a little bit tender, so you can see the column here on her. What I do is I enter through the lip, and I just add a little bit of volume in there. Doing okay?
Mm-hmm.
Following her natural shape. You can see how that just popped it just a little. So we'll do the other side and then we'll see if we need to add any more. And the last thing I'm going to do on her is just the little central portion of the upper lip. So open for me. You can keep holding the buzzy. So this is how we prevent sausage lip. We add a little tiny bit right here because most people have that little bit of centralized volume. And so we want to maintain that. When that gets obliterated with injections, that is when it can look kind of fake or done. So if somebody has that naturally, I try to keep it. And then we've got the Cupid's bow and the philtral columns. It's really the details that keep things looking really natural. Okay, so we're done with first pass. What I don't do is chase swelling. So she's having a little more swelling in the upper lip than the lower lip. Totally normal because there's a lot more pokes that happened in the upper lip. I was able to just use a couple of entry points in the lower lip. So what I don't want to do is add a whole lot of volume to the lower lip to try to make the proportion 70-30 or 60-40, which is a very typical lip proportion for a Caucasian female. So what I usually do is if someone's having swelling, I just have them come back for a normal follow-up visit like I do with all my patients at about 2 weeks. And at that time we can add a little bit more anywhere we need to. It's very normal to have lumps and bumps during the first 2 weeks. If it's a lump or bump that feels a little bit tender, it's usually a bruise. If it's not tender, it's usually a little bit of product. If you leave it alone, it will incorporate with your tissue and you won't be able to feel it. Every once in a while, someone can have some little lumps or bumps that stick around. Those are typically some product that gets encapsulated by the body. So the body sees, oh, foreign invader, it encapsulates it as a protective mechanism. If that happens, you don't have to live with that. Come on in, we can take care of it. It's totally normal for it to happen. It doesn't mean your injector did anything wrong. We see a lot of people that come in from other places, and I have to have that conversation that, no, your injector didn't do anything wrong. This is just how your body reacted in that spot. We can massage those down. You can massage those down if you can't be patient enough to wait for it to incorporate. And then we can do a little touch-up anywhere we need to. I will probably add a little bit more volume to her lower lip at that time. I have about 0.2 of my syringe left, so about 20% of it left. I typically save about that much for touch-ups. It's also very normal for things to settle out a little bit unevenly. Lips typically do take 2 visits, very normal for that to happen. A little bit of ice to bring down the swelling is just fine. It's nothing that you have to do all day. A little bit of ibuprofen in a little while is normal too. So post-care instructions. Also, you can use a little bit of ice if you need to throughout the day. You don't have to. Some ibuprofen or Tylenol. Once the numbing that's in the product wears off, your lips will be a little bit tender. Totally normal. A little bit of ibuprofen, ice, or Tylenol will be just fine. You can wear chapstick or lipstick in just a few hours once everything has stopped bleeding, which it has. Expect some bruising. It might not show up until tonight or tomorrow. The swelling will be most prominent tonight and then in the morning, but should be back down in about 3 days or so. If it's significant or you're worried about it, let me know. If we need to, we can call in a prescription anti-inflammatory for you. That's about it for post-care, pretty easy. The other instruction is no aggressive kissing for a week. I don't know what that means, but that's what I'm supposed to say.